Hello, my name is Stephanie Hafe doing the cardiovascular video. I'm trying it on my laptop again because it takes forever for the videos from my phone to go to YouTube. I will also be using my American Girl doll again so you can see where I'm at a little better for this video. So I would start off introduce. Hello, my name is Stephanie. I'm the nurse. Today I'll be assessing your cardiovascular system. I will be inspecting, kind of palpating, touching, feeling things, and then listening as well with my stethoscope. Is that okay? Can I please see your armband and can you tell me your name and date of birth? It matches. Pull the curtain for privacy. And I would perform hand hygiene before I touch the patient. Should have done that before while I was introducing myself, I should have done hand hygiene. I'll say that. So for this, I'm going to, my kitten's coming. I'm so sorry. She's like in every video. Stethoscope and gloves if needed, if there's lesions that I find. And those are the main things today. So I would ask the patient, have you ever had chest pain? Have you ever had a history of cardiac issues? If they do, go into detail about them and really assess, look through the chart as well to see if there is documented and if they're on a plan, a care plan or not for their cardiac issues that they had. I could also ask if they have a history of leg swelling, edema, trouble breathing. Those things would kind of suggest CHF, but also heart issues. So after asking those questions, I would go ahead and start. So I would ask the patient to lay flat. Let me see if I can actually put her right here. Oh, you can't see her. Okay. I'm gonna hold her. Pretend her legs are up like she's on a bed. I'm not trying to have her, and her arms are up too, pretend. I'm not trying to have a patient looking like a cold blue over here. So what I'm gonna want to do is just palpate the neck. Maybe I just stand her up so I can show, but I'd have them laying down. You're gonna want to do one carotid at a time, otherwise you will have a code white. So I would palpate one carotid, make sure there's no evidenced thrill, brute, murmurs that I could feel. Feel for the force of the blood flow. Do one. I apologize, I'm yawning. Do the other. Like I said, don't do them at the same time. Also inspect the neck at this time to see if there is any lesion, swelling. I know you see it a lot of times on cartoons, but seeing the actual vein palpate or beat palpates when you touch them. Seeing the actual vein. I know some people when they get very angry they have that vein in the forehead that pops out. So looking for that too, even on the neck, face, wherever you're looking. So I'm going to make sure that both sides are also equal bilaterally. As I'm doing that, I'll let the patient know. You have great pulse, strength, everything's equal bilaterally on both sides. And then I'm also going to want to inspect the apical. So she doesn't really have a, but you can see, like mid clavicle, whatever. No ribs, but you feel down to the fourth or fifth intercostal, and mid clavicle is the apical spot. So I'm just, gonna look at that spot, see if there is any lifting or heaving that I can see it moving in the skin without palpating. I'm going to go ahead and palpate that as well. Find the pulse. And, just like I can't see her clavicle here, you may not on an obese patient. So, that's what I'm doing, kind of an estimate of where you're, where the clavicle normally sits. Do mid. It tends to, on a male, like be below the nipple as a place, sorry, on this side, below the nipple. Just so you can think of that and make sure you are 4 or 5 intercostal down. So then, sorry, I want to also make sure that I would have it more organized. I'm not going to listen yet to her carotid. I'm going to do that when I'm listening to other things as well. So I'm going to keep going down the inspection. And when I'm palpating things, I also just want to inspect them. Like I said before, any lesions, any lifting where you're actually seeing that beat through the skin, visualizing it like you would visualize respirations, except you're going to be visualizing the heartbeat below the skin. So you're looking for that. You're also feeling for that, as well as feeling for the actual pulse. So one place that I would also like to palpate is going to be the apex. You're going to go all the way down from the sternum. I can't talk today too either. That's great. To the apex at the bottom of the sternum. I apologize. It's part of the anxiety, getting those words out because I'm videotaped. And just feel, across the bottom of the heart, the apex. You're feeling and asking them if there's under any tenderness, and also feeling if you can, if you feel the heart beating, the valves opening and closing. So that's, where you generally want to feel and look. So as far as auscultation now, put my ear in my stethoscope. Okay. Here we go. Here we go. I want them to go forward. First time I ever tried, I'll just let you in on this. I put them backwards and wondered why I couldn't hear. Okay. Now that you know that. I'm going to go back. Like I said, I wasn't going to do it right away. So I'm going to use the bell, the smaller side, not the diaphragm, to listen to the carotid. And again, one side at a time, just in case you are pushing a little too hard. And I just want to make sure, I mean, she's small, I can't really show, but obviously on me, I don't want to listen to my carotid really, but there it is. And then also, acetating everything. For the measuring the heartbeat, you are going to want to use a diaphragm and go to the apex. So again, that's mid-clavicle, I'm guessing with her, and educated guess. And I'm going 4 to 5 intercostal down, and I'm going to listen for 1 minute. That really sounds weird because she's obviously full of stuffing. You want to listen for 1 minute to get an accurate heart rate. I know some people like to do 30 seconds, multiply it by 2, 15 seconds, multiply it by 4, but you want to do a full minute to get an accurate heart rate. So, it's hard. After you're doing that, I would say if I am going to be feeling that, and what I am feeling when I'm doing that and listening to it, if there is any brute, if there is a murmur, what am I hearing? So I also want to then listen to all 4 of the valves. She's tiny, so I'm not going to be moving much, but I'm going to really try and show you. So I do want to hear each of them. I do want to hear the dub dub, or dub lub, as we say. And I want to listen for any murmurs, any bruit, any thrills, any missing heartbeat. Just really listening to what's going on. So the S1 is aortic. Aortic is going to be the second intercostal on the right side. So sternum, second intercostal, plop it there, listen, make sure I can hear it. And this, you kind of want to make a Z pattern. So I'm going to stay in that same intercostal, and I'm going to go over so I can hear and acetate the pulmonic valve. I can actually hear the heartbeat through my hand. Oh, that's weird. So then you want to go down another, would that be 2 or 3, to go to the 4th or 5th intercostal, still along the sternum. So that's going to be a tricuspid. Sternum 4, 5. I know it looks like I'm not really on the side, but that's where I imagine it would be for her. And then the last one, so we started here, went over, down, and then we're going to go over again. So that's why I call it like the Z pattern, that we're going to be listening to it. So the S1 is definitely going to be louder at the apex, and the S2 is going to be louder at the base up here. So that's something to remember as well. Mitral is going to be that apex area. It's going to be mid-clavicle, 4 to 5 intercostal. So I was at 4 to 5. I don't remember exactly where I was, but you want to go over to the mid-clavicle region and listen. Again, like I said, the S1 should be louder at the bottom, S2 louder at the base. I'm going to have to get used to having these in my ears. I might need the smaller one. This is good for me to know for moving forward. And I'm going to want to, or I should make note, sorry, that when you are feeling and palpating these areas, you do want to do it with 1 or 2 fingers, not your whole hand, not your palm. So I did that with the diaphragm. I'm going to now repeat it with the bell. So again, I'm not going to name everything so I can get through this video a little quicker. Do the Z pattern. And listen more than I did, obviously, to hear everything again. So her then, just to kind of see the measurements when the person is moved and in different positions. So like I said, we pretended she was laying down, but she looks like a code blue, so I stood her up. So we're going to put her on her left side, left laterally, and we're going to again find the apex, middle clav, 4 to 5th, and listen while she is this way. And then another one that we'll do is have her sitting, which she can't really do, and again listen to that apex. Checking if the heartbeat is changing significantly, and if you're still hearing the same, no thrills, the +2, sorry, my ears are sore. I say no thrills. I sure did. Yep, which is fine. So I'm gonna want to you're when she is in that sitting position, I just want to make sure that she's not having aortic regurgitation, murmur in that apical spot. Okay. I want to keep listening for the S1, S2 as well. So let me get these out. Sorry. Talking louder. Sorry if I was talking louder earlier. So I want to palpate all the pulses with her as well. So this is going to mean going through all of the pulses. I think I can do them section by section, really. So the arms, again, you're going to look at them, inspect them, make sure there's no lesions, edema, reddening, anything that might be of concern. You're going to look at the nail beds. You want them to be less than 180 degrees. You can kind of look from where the nail bed to the nail goes, that degree is what you want to look at. Above 180 degrees is going to be clubbing of the nails. So you want to inspect them for that, as well as, capillary refill. Just inspect them in general. So these pulses that you want to do are going to be the radial. So way over here, you're going to use generally these two fingers, pointer and middle. Can't think of it. Don't want to use your thumb. You'll feel your own pulse. And you're going to just make sure it's present. There is no thrill. It's at a 0.2 force. And then it's not weak, thready, or over forceful. Then you would most likely have hypertension going on, tachycardia at the same time if you feel it really pulsing through. And then the brachial is going to be where you put the blood pressure cuff inside by the elbow. You want to make sure your my 2 fingers goes well up into your arm. 2 fingers up and feel it. Again, you can use the same 2 fingers or one, just easier for me for this little arm. You're gonna want to also look and see if the skin is warm, moist, as you're feeling. Temperature is always with the back of the hand. Once you feel those pulses, you're going to want to look for turgor of the skin. Best is up by the clavicle. Pinch it. Make sure it flattens right back out. Or you can do the back of the hand. Pinch it. Make sure it flattens out. If it stays up, you're going to be dehydrated. So as I move down from the neck, chest area, arms, we're going to go down to the legs. So we're going to inspect your legs. This is where you see a lot of edema happen for CHF patients. If there is edema, which she does not have, you want to do the pit test where you push in and see how many seconds or how far down it goes and how long it takes to come back up. Sometimes it can be a little while. As far as her legs, again, we're going to inspect for the lesions, the redness, the edema, the swelling, temperature with the back of the hand always, redness, anything that is abnormal, we'll be looking at for her. And those, if you do come across something like that, you can follow up with questions about, have you noticed the swelling in your leg, even though their ankle might be gone? How long have you had it for, and things like that, and follow up with that as well. So as far as lower pulses, I'm sorry, my cat's trying to be in the video again. Femoral is going to be down by the groin area on your leg. You can feel that again, inspect it, feel it. You're going to want to know, stop it, go, 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 go. You want to make sure, again, it's not too fast, not too slow, not thready. Normal is a +2. So femoral, popliteal, if I'm saying that right, popliteal, sorry. Back behind the knee. They would normally have their knee bent in a 90-degree angle. You're going to want to go, the 90 degrees is like this. You're going to feel behind the knee. And then posterior tibial is going to be, you're going to look in the interior. It is back behind that little ankle bone. That's best how I can describe. You're going to want to feel there for a pulse. And then as well the dorsal pedis pulse. These legs are really free and flying. I'm not used to that with American Girl dolls, sorry. You're going to go right at the bottom of the ankle, top of the foot. You can feel, I don't know if I'm actually showing you. You can feel it run down a little bit, but you want to take it right at the bottom ankle, top of the foot. Again, make sure it's a normal 2+. You don't want any of the weak pulse, thready pulse. Those are all very bad signs. And if I missed, when you inspect the skin, you want to look for the color, the texture, the temperature, lesions, redness, swelling, anything abnormal. Just go, oh, oopsie, sorry. Just gonna throw that in there. And then that is it for my video. I would let her know and discuss all of her findings. Like I said, I kind of like to discuss it as I'm going along, so it's not just this long, quiet, me touching them and them sitting there. Kind of involve them, like let them know, good, it's a +2. That means that it's normal pulse. I can feel it. It's great. And let them know that way. That is my video. Hopefully this works out better than the YouTube. Thanks.